Hello, everyone, and welcome to our Reproductive Justice panel discussion on the state of reproductive health care today. As we begin tonight's very important dialogue, I'd like to invite you with intentionality to participate in a land acknowledgement and recognize that wherever you are calling in from today, we have an obligation to always remember and recognize the rightful owners of the land we congregate on. We acknowledge the traditional, ancestral, unceded territory of the Lenape nations on which we're learning, working, and organizing today. I'm here in New York City. We honor and give thanks and gratitude to the Lenni Lenape and Wappinger, the ancestral traditional stewards of this land throughout the generations. We pay respect to their elders and past and present. We join with Indigenous First Nation peoples, recognizing history and culture and honoring the truth of this country and the truth of many lands. I invite you to take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together today. Thank you. It is with great honor and admiration I introduce a few of the members of the Reproductive Justice Initiative, which is located in the Action Lab for Social Justice at Columbia School of Social Work. My name is Ovita Williams, and I am the Executive Director of the Action Lab. I'm so very pleased to open up the event and to have you meet the moderators for what is at this point the third such reproductive justice community education panels within the past year. The Action Lab is a student-driven center dedicated to creating actionable, purposeful, and consistent change towards anti-racism and social justice. Students, faculty, and supporters from many places have worked to bring this event together, entitled The Future of Reproductive Justice, a panel discussion on the impact of Texas SB 8, hosted by the Reproductive Justice Initiative, the Institute for the Study of Sexuality and Gender, and the Office of Professional Excellence. The purpose of this event is to discuss the implications and aftermath of Senate Bill 8 in Texas and nationwide. Senate Bill 8 is a policy put in place in May 2021 in Texas, banning abortion after detection of a fetal heartbeat, which is typically around 6 weeks. This has broad implications for women, healthcare, accessibility, human rights, and is a justice issue requiring ongoing attention and activism. Our stellar panelists, who will be engaging in a robust conversation very shortly, have been called together due to their advocacy and work around reproductive health access in Texas. We would like to thank the University Life for supporting this event through the Racial Justice Mini Grant. Now I'd like to introduce Ash Cole Jr. and Olivia Cordingley, our moderators. Ash Cole is a native from Far Rockaway, Queens, and a graduate of Queens College, and is currently a second-year advanced generalist practice and programming student at Columbia School of Social Work. Ash is the vice president of the Association of Black Social Workers at Columbia University, a student advisor for the Action Lab, a research assistant at the SAFE Lab, a Beyond the Bars fellow alumni, and the lead facilitator for Emojo Circles, which is part of the Action Lab. He's also a co-author of the book entitled Unwritten: Stories from Behind and Beyond the Bars. As a first-generation graduate student, he shares in many of the lived experiences of the people in which he serves. He's an advocate for criminal justice reform, fathers who have been negatively impacted by the Child Support Enforcement Unit, and the mental health of young Black boys in academia. When he's not working to break the bondage of systemic oppression, you can find him with his family. Hi, Ash. Olivia Cordingley is also a second-year social work student in the Advanced Journalist Practice and Programming track as well as a first-generation student. She coordinates the Reproductive Justice Initiative within the Action Lab and is one of the recipients of this year's Racial Justice Mini Grant. She works with the Social Intervention Group, where she researches stigma around sex work and drug use, and is a hotline volunteer for HIPS, a nonprofit dedicated to harm reduction in the sex work community. Hi, Olivia. Thank you both, and we look forward to this evening's event. And thank you to our panelists and organizers.
Thank you, Ovia. Thank you for the land acknowledgement and for introducing Ash and I. I'm just going to ask our panelists to come on camera now if they can. And then Ash and I are going to take turns introducing everybody. So we have 5 panelists in all. And first I'm going to introduce Amanda. Amanda Beatrice Williams is a proud daughter of an immigrant, a queer Tahana with more than 10 years of experience working in reproductive health, rights, and the justice movement. She's originally from Houston, Texas, sorry. My New Yorker self thinks of Houston Street, where she planted her roots as a community organizer. Amanda holds a master's in political social work from the University of Houston and has extensive background in program development, policy advocacy, nonprofit management, and fundraising. She served on the board of the Lilith Fund from 2012 to 2015 and has been Lilith Fund's executive director since 2016. Under her leadership, Lilith Fund has supported thousands of Texans seeking abortion care and expanded its programming to include organizing and more comprehensive support for hotline callers. Amanda is a proud storyteller with We Testify, an organization dedicated to the leadership and representation of people who have abortions. Her writing has been published in Glamour Magazine, Mrs. Magazine, Rewire News Group, Trib Talk, and The Feminist Wire. Amanda lives in Austin with her wife Holly and cat Mika. Thanks for being here, Amanda.
All right, and next we have Roseanne Param. Please forgive me if I mispronounce your name. Roseanne Param is the executive director of Jane Doe's Process, an organization that fights for teens' reproductive rights in Texas and helps young people confidently access abortion and birth control. She has been working with the reproductive health rights and justice for the last 10 years on the national and state level. Roseanne is a graduate of the University of Texas School of Law, City College of New York, and New York University. She's originally from Ohio and a proud daughter of immigrant parents. Roseanne, thank you for being here today.
We also have Carrie White here. She's an associate professor at the Steve Hicks School of Social Work at the University of Texas, Austin, and she leads the Texas Policy Evaluation Project, also known as Texas PEP, if you've heard of it. She got her PhD in sociology with a concentration in demography from the University of Texas at Austin, an MPH from Tulane University, and an MA in Latin American Studies from the University of Arizona. Thanks for being here, Carrie.
All right, and we have Lauren Thaxton, a board-certified OBGYN and an assistant professor in the Department of Women's Health at Dell Medical School and an abortion provider at the Whole Woman's Health, Austin. She came to Dell Med from the University of New Mexico, where she completed both her residency and fellowship in complex family planning. She received her medical degree from the Texas Tech University Health Science Center School of Medicine and holds a master's degree in biomedical sciences with a focus on clinical research and a master's of business administration with a focus on health organization management. Thank you for joining us, Dr. Thaxton.
And lastly, we have Liza Fuentes here. She's a senior research scientist at Guttmacher. I always pronounce that wrong, so I want to make sure. Her research has focused on access to and use of contraception and abortion services, evaluation of abortion restrictions, and clinical training in reproductive health. She currently serves on the board of directors at Forward Together and Taller Salud. Previously, she was a co-founder of the DC Abortion Fund and the treasurer of New York Abortion Access Fund. So we're going to start by asking, how has SB 8, and if just so everyone is understands what SB 8 is, but it limited abortion access after 6 weeks of pregnancy. We were curious to know how this has affected your organization from its day-to-day operations to its overall history and mission.
Yeah, thank you for having me. Hi, everyone. Because I think we're all sort of affected in similar ways, similar and different, as abortion funds in Texas. And in that way, we're really all in this together. And I think there's, some silver lining and a lot of like power building that we've been able to sort of see flourish in this time. But nonetheless, it has been absolutely devastating for abortion access. For my team as an abortion fund, in Texas, doing this work in the South, we have seen attacks on abortion access for decades, right? Like this is, not new necessarily, but it is indeed the most severe that we have ever seen. I mean, y'all probably know this is like, the most restrictive abortion ban to exist, to, be upheld in the judicial process in the country. So it's just remarkable what has happened. And for us, front and center, of course, is going to be the impacts on our clients. As a direct service organization, our entire mission revolves around funding abortion and building power. There's a lot of work that goes into those two sort of pillars that are our work. But, leading up to SB 8, when it was originally passed in September, we had to put so many of our proactive, exciting, innovative projects on hold, and really take a huge beat and say, okay, like, what are we going to do to protect ourselves from lawsuits? Because I think, so everyone knows, right, there's a 6-week ban component, but the other really terrible part of this bill is the private cause of action provision that allows anyone from anywhere to sue someone who they think could be helping someone get an abortion not in compliance with SB 8. In other words, after 6 weeks. And so this allows basically people like us, abortion fund supporters, to be inundated with lawsuits, costly, frivolous lawsuits. So for us, thinking about the future of our work, we really had to consult with a lot of attorneys and put a lot of protections in place so that we could be ready to defend ourselves, but also to avoid liability as much as we can. And that's just not necessarily something we're used to doing. Like, we are not attorneys, right? Like, we are everyday activists, organizers who are just simply trying to help our communities get the healthcare that they deserve. So, to figure out what this law really means and how to have the legal, backbone that we need to do our work, like that was really new for us, and that was very, very hard. I could go on and on, but I'll pivot to Roseanne. Maybe I'll jump in, but I have a lot more to share as the night goes on.
Happy to. So I'm with Jane's Due Process, which was founded about 20 years ago when Texas passed its first set of parental involvement laws. So those are laws that require anyone who's under 18 to have a parent or guardian's permission to access both birth control and abortion care. So those were passed in the late 90s, early 2000s. And for birth control, teens can still go to like federally funded Title X clinics, so they can still obtain care in some ways. But if you're under 18 and you need an abortion, you actually have to go speak to a judge and get permission from a court to have your abortion confidentially. And so Jane's Due Process was actually founded by lawyers to sort of navigate that process. And over the last 2 decades, we've evolved to really provide a lot more wraparound support as well. So we help teens with finding an attorney who represents them for free. We help them get to the clinic and courthouse for all of the appointments that they need. We're also now an abortion fund. So like Lilith, we pay for abortion care for teens. But all of that just had to change kind of overnight when SB 8 took effect. I talk about parental involvement laws as abortion restrictions because they inherently cause delay. So if you have to go to court and talk to a judge, that's weeks that are added to the time between when you decided you want an abortion and when you were able to get it. On average, before SB 8, we would say it would take 2 to 3 weeks from when someone reached out to our 24-hour hotline to when they actually got their abortion. So like a 3-week delay. But the vast majority of people don't know they're pregnant at 6 weeks. And so say you find out you're pregnant and it's 5 weeks, you add that automatic 3-week delay and you might be pushed past the ability to get an abortion in Texas. So for us, it was trying to figure out how to take an already burdensome process and super speed it. And to be completely honest, the majority of teens who are reaching out to us are not able to get through it. We help everyone we can, but for our clients, they're already keeping their pregnancies private from their families, or they are de facto orphans and kind of don't have guardians or adults in their lives. Some might be involved in foster care or the CPS system, some are in immigration detention. So our young people are just completely trapped often by the 6-week ban. And I try to talk about that honestly, because a lot of people are being forced to be pregnant against their will and not everyone can leave the state. So it's an awful reality, but it's what's happening. And it is a human rights crisis. It's happening every day in Texas. So we do help the youth we can go through that process under SB 8, but in the majority of cases, it's not really possible for our clients to get care.
Thank you so much, Roseanne, and thanks for speaking a bit about Jane's due process. We'll send something out as well so people can follow. And Amanda, if you wanted to maybe just say a quick thing about Lilith Fund, and then we'll move on to a question from Ash.
So Lilith Fund is the oldest abortion fund in Texas. We were founded over 20 years ago. We have an English and a Spanish hotline, and we fund abortion. So we help people cover the cost of the procedure. And now we're mostly, the majority of our clients, we're funding procedures for them out of state. Which is new. So speaking of like ways that we've had to evolve our work, that is definitely something we're not used to doing. So we've had to reach out to providers and clinics in all of the surrounding states, even like the states you would not expect that would be better on abortion than Texas. It's like, oh yeah, Louisiana, you know, or Florida, like they're going everywhere else that they possibly can. And we're working with the clinics who are helping our Texans get the care that they need. So before SB 8, we were primarily serving the central and southeastern region of Texas. So another big important thing to know about abortion funds is that you know, we're typically smaller grassroots organizations, and Texas and other large states, I mean, it's geographically covers a lot of ground. And, you know, at one point there used to be, well, over like 40 clinics in Texas, but that has drastically evolved, as you can imagine. But for the most part, there are about, you know, 10 or so abortion funds serving the entire state and working within the entire state of our providers, doing whatever we can to work together and support our clients who are getting abortions in Texas, but the majority of them are indeed going out of state. So that's a big shift for us. And another big shift is that we typically would only cover a small portion of the procedure, but I guess part of the silver lining of all of this has been the outpouring of support, and now we're actually able to pretty much fund the full cost of people's procedure right now. And a part of that also is because we're hearing from maybe 50% less, 50% fewer people than usual. And so that tells us a lot of devastating things, right? Like Roseanne said, this means people are continuing a pregnancy against their will, right? Or, you know, we're just not hearing from them, we cannot find them. And that's just, it's been really, really difficult for us to grapple with.
Thank you for sharing that. It's great to hear about your organizations and the work that you're doing. And it's good to be amongst the people that are doing the work. So thank you for sharing that. And Dr. Thaxton, this question's for you. If you can share a little bit about your practice, and then additionally, could you share some examples of how this is impacting you personally as a clinician?
Yeah, thank you so much, Ash. So as far as my practice, I am an academic OBGYN. I work with Dell Medical School, but I also I'm the Ryan Program Director, which means that I teach OBGYN residents family planning, including abortion and contraception. And I provide abortion care at home in South Austin. So I also am on the ground providing abortion care. And I guess to the question of how it's affecting me personally, I resonate. You probably saw all of us nodding our heads as Amanda and Roseanne were talking, because I think we share a lot of the same feelings of trauma, frankly. All of us are in this work because we want to help people. And I think we're also, experiencing the trauma of SB8 on top of the fatigue and burnout of COVID, and being, close to people seeking healthcare during a pandemic, which also very much limited people's access and ability to get abortion care. So I think the word that has been used that resonates the most with me as far as kind of what that experience is like is moral injury. You go to medical school to learn how to help people, and this bill is in direct violation of every part of medical ethics, right? And additionally, I'll just say that, like, on the ground, in the clinic, day to day, and I'm sure that Roseanne and Amanda also have this experience, we're just also absorbing so much of these terrible and heartbreaking stories every day from people about why they need to end their pregnancies. I mean, everybody has a reason, and it is very hard as a provider to have the training, have all the right stuff, be in the clinic, and still have to say, I'm sorry, I can't help you, but I can help you try to find that somewhere else, knowing that that is not accessible to many people.
Thank you for sharing that, Lauren. We're going to move on to Carrie. And I'm wondering, Carrie, if you might explain a little bit about Texas PEP, and then how SB8 has affected you personally and your work as an academic and a researcher as well.
Yeah, thank you, Olivia. The Texas Policy Evaluation Project is a group of researchers that has been looking at the impact of legislation in Texas that affects people's access to contraception and abortion care. And we've been doing this work for about 10 years. And Texas, unfortunately, gives us no end of things that we can look at and do with all of the different restrictions that it has put in place. And when SB8 was passed in May of 2021, I think probably like many people in Texas, and outside of Texas, we thought, this is so blatantly unconstitutional. This is never going to go into effect. Like this just can't happen. But we decided that we would, our team would prepare and start putting studies together to look at the impact of this law if it did indeed go into effect. And like Amanda said, we had some other exciting projects that we were planning on doing, and those just had to go on the back burner, and some may be completely impossible in the future because of the devastation that this law has created. And what this meant for a team is that over the summer, we were, busy reaching out to colleagues in other states, hoping that we would be able to get them on board to track information on the number of Texans who were obtaining care at their facility, and hanging our heads when we were making these calls and sending these emails, because we had just done that a year before when Texas had put in place another ban on abortion at the onset of the pandemic, and calling our colleagues and saying, I know you did this for us before. Could you please do this again? We're hoping this policy won't go into effect, but just in case it does, is this something you might be able to do? And moving things around in our budget so we could compensate people for taking part in this work, putting together surveys that we thought we might never need to use. And, you know, on September 1st, we found ourselves in a position where we needed to put these plans in action. And, you know, because of the hard work that we did over the summer, we were largely prepared to start documenting the impact of this law right away. And we were able to put out very soon after the law had been in place for a month, we were able to show what the initial impact of the law was, and that the number of abortions in Texas had decreased by 50% compared to the previous year, which is the biggest decrease in abortions that we have documented in our research, bigger than the decrease that we documented when half of the facilities in Texas closed following another restrictive law in 2013, and bigger than the decrease in abortions that we documented when the ban on abortions at the onset of the pandemic was put in place. This was just like nothing we had ever seen. And I would say one of the challenges as a researcher, in addition to, like Lauren said, just kind of being exhausted by the pandemic and exhausted by the never-ending crises that the state government seems to create in access to care, I think what has been frustrating as a researcher, or challenging as a researcher, you know, our job is to produce and do rigorous studies, generate sound evidence on the impact of these policies, and to have the data coming in and feel like it's not coming in fast enough, or that we don't have enough to do like a really thorough analysis just yet. We have to wait while this crisis is going on, while it's fading away from the news cycle, I think has been really challenging for our team, because we know we have a lot of information out there. We are trying to get some pieces of information into, you know, reporting it out to journalists and things like that. But, you know, our job is to do the science, and we don't have all of the information just yet to tell the story that we need to tell.
Yeah, very, very well stated. Thank you for that. And so the next question we have is for Liza. If you could tell us more about your organization, and then also how has this been impacting you and affecting you as well personally?
Yeah. So yeah, I work at Guttmacher Institute. We're a nonprofit organization based in New York and DC, and we do research, usually from a demography and public health perspective, and policy analyses around sexual and reproductive health in the United States and outside the United States. Our sort of focus in US-based data collection and research is surveillance of abortion provision. So we calculate an abortion rate of the entire country about every 5 years. And our census is considered a complete census because we maintain and then contact every single abortion provider in the United States. And so when you look up what is the abortion rate for I won't say Texas, because TexPEP has done some amazing work on abortion rates in Texas, but for many states, if you look up the abortion rate, let's say for California, that is the work that we do. We also do surveillance of the delivery of publicly funded family planning in the United States. We calculate unintended pregnancy rates by different age groups. And so we really provide high-level data for advocates, policymakers, the general public, students, and other researchers to have a really strong snapshot about reproductive health behaviors and access to care in the United States. So in terms of SB 8, in terms of and how it affected our work, it just so happened that in 2020, we were fielding 2 major data collection efforts that look at abortion in the United States. One is our abortion census. And so you can tell by the word census, we intend to count every abortion provided in a 1-year period in the United States, and our abortion patient survey, where we draw a nationally representative sample of abortion patients and administer a survey to them. And so this helps us understand the sociodemographics of who are abortion patients, how far did they travel to get to where they're going, how is their abortion paid for. So for example, we know that about 1 in 4 abortion patients in the United States identify as Catholic. How do we know that? Because of the abortion patient survey. So a couple of things. Everything that Carrie said resonates a lot from a bit of a different perspective because we are not Texas focused. But the need to pivot and try to understand how we can collect data that is useful to advocates and activists who are in the midst of trying to communicate about and fight abortion restrictions is always a challenge. And with SB 8, it was escalated. First, because real-time impacts of these policies is very difficult. One of the things that we were able to do is add a few questions onto our survey in a very rapid manner that was very quick for what we would normally think of as, social science or public health, to try to ask providers in other states what their experiences were in terms of SB 8. And we were able to publish a very quick blog post showing that we heard from providers in at least 12 states that after SB 8, they were seeing patients from Texas. This is probably nothing new under the sun for abortion funds and people working in Texas, but to communicate that as a national snapshot, we thought was important. Additionally, we found that abortion providers, not necessarily in the next nearest state, but several states over, we're continuing to see patients from Texas. So we sort of have real data on the incredible burdens that patients faced. Of course, the frustration is that for every patient that was able to travel 1, 2, or 3 states away because they were too far along after SB 8, we know that there are the stories and experiences of people who sought abortion and were never able to get them. And those people, those of you who do the work of abortion funds hear those stories. Like we just heard, if 50% of your caller volume goes down, like Amanda said, that gives us an idea about who's not being seen. Carrie's work has also shown when the abortion rate goes down so tremendously, you can only imagine that decline represents people who are simply not being seen. Some of those people may be self-sourcing or self-managing abortion, but the possibility that everyone's able to do that safely and effectively and on time is probably pretty low. Another way that it has affected our work is we have put aside analyses, just like Carrie's team and TextPep, to really think about how can we draw on our data to communicate the impact and severity of what is going on to more people. Because in our experience, even though this is the most severe, draconian, backwards, harmful violation of human rights among abortion restrictions that we've seen, to have it be part of the public discourse and have people really understand the canary in the coal mine that this represents, we were digging around. And so, one of the things that we did was refresh our policy analysis to see what is going on with how far people would have to travel. Even if we're not capturing those stories, the question is, how far do we think people are going? And then we sort of took a lay of the land and said, what else do we think this means, not just for Texas, for other states? And we started tracking copycat laws, states like Florida that pledged to introduce a similar law because they got the green light essentially from the Supreme Court that they most likely would be able to get away with doing that. And so we now are able to kind of communicate that when an abortion restriction is passed, it is not arbitrary in the sense that it's a one-off that's particular to that state's culture or public sentiment on abortion, but rather it's a concerted effort to have a domino effect and have these laws introduced in other states. And then finally, I'll just say, when you say personally, how does it impact me? I live in New York and I haven't needed an abortion this year. So in that sense, it hasn't, but as someone who has been an advocate and a participant of championing abortion funds and having a very passionate, talented staff for whom emotionally working with clinics day in and day out to collect data when the clinics are being burdened by SB 8, it's demoralizing for our staff. And we want to protect and be respectful of clinic workers as we ask for them for more data when they're just trying to see patients. And so that's a balance that we're trying to strike.
Thank you for that. So just to switch gears a little bit, we have a question for our directors. So Amanda and Roseanne, kind of whoever wants to take this, or you could take it together. Amanda, you touched on a major part of SB 8 that a lot of us are really concerned about, the sort of policing aspect of being able to turn in anybody that procures an abortion, or knows somebody that does. And we're curious about the implication that this has on communities that are already over-policed, specifically Black and Brown communities, Indigenous communities, impoverished communities. And we're wondering, how are your organizations, or are you seeing other organizations kind of move to fit and address this policy, this aspect of it?
So yeah, I think this is an incredibly important part of the law, and Amanda spoke to it. So I think one piece is just it was so unclear. The way the law is written is terrible, and I say this as a lawyer. It's just gunk. They don't define so many of the terms in it, so the vagueness of aiding and abetting has caused a lot of confusion as to what kind of information you can share, what counts as aiding and abetting, who can be sued. And I think that makes it particularly scary for people who are trying to find information when they're pregnant and they need an abortion. So I know, at least at JDP, we saw a huge drop off in calls and texts right away. I think people were just scared to even talk about the fact that they were pregnant. The law does specify that the pregnant person cannot be prosecuted under SB 8. However, like if you're an older sister and you help your younger sibling, find information, like does that qualify? So I think particularly, we know that abortion restrictions are inherently racist because they disproportionately impact communities of color and are often designed to police the reproductive bodies and decisions of communities of color. So I do think that the weaponizing of this law, the focus on private lawsuits, the attempt to avoid judicial review, it's all just a continued effort by anti-abortion extremists to really make it impossible to even share information. That being said, I love being part of the Abortion Funds Network. I am so grateful to work with people like Amanda and the folks at Lilith Fund, because we're not backing down. We are making sure that people have the information they need to find out if they can get care in Texas. If they can't get care in Texas, where can they go? Needabortion.org is a wonderful website that lists all of the abortion clinics and abortion funds in Texas. And Lilith Fund actually helps update and maintain it. But I think this law was designed to make people be scared of seeking information and to penalize and hurt anyone who's trying to help in Texas. So that part has proven to be true. I'll pass it to Amanda.
The only thing I'll really add is it's absolutely no coincidence that the people most harmed by all abortion restrictions are people of color. The majority of our clients and the majority of all abortion fund clients are women of color who are parenting, who have children, they're struggling to make ends meet, they're working multiple jobs, they're students, they're young people, they're immigrants, they're already facing the brunt of every single systemic form of oppression there is, right? And it is there's that meme of Pam from The Office where it's that's the same picture. Well, I'm holding up white supremacists and the people behind these laws. It's the same picture, they're in cahoots. It is absolutely by design. And we see it every single day. Abortion funds exist because people cannot access abortions, but specifically we have to name who those people are, right? And what privileges they cannot afford. Wealthy people, typically white women, will be able to access abortion, right? Forever and ever and ever, amen, right? That's just how that's going to be. It's how it's been. But that's why we need to work together. And we cannot rely on the courts and we cannot rely on the state to build the kind of infrastructure that we deserve, that communities of color deserve. And often, that looks like abortion funds, but it's going to take a lot of community organizing, and it's going to take a lot of listening to people who have been through it and have had abortions. And it's going to take a lot of following the leadership of Black women specifically, who have coined the framework of reproductive justice. And I think that's, I mean, that's just, it's where we are now. Like, we are here, and it is like time. It's like beyond time, right? We're like a little too late to start organizing with this framework. But I hear someone mentioned earlier, like, gosh, we're hearing these heartbreaking stories every single day. And what's really unfortunate about this law is that it perpetuates abortion stigma, and it's going to continue to stifle and to silence voices. But we need to combat that every way we can by uplifting abortion stories, especially those of people of color.
Yeah, thank you for that, Amanda. That's a great point, and I think that'll take us to our next question. So this is for Dr. Thaxton. Um, I know before when you spoke, you had mentioned, you went into medical school, and many of your colleagues and the students in which you work with, they went in under the premise to help people. So, definitely, it definitely makes sense. And then just kind of build off what Amanda had mentioned prior. So the question for you is, how are you and the folks within your clinic and also within your practice and the people that, the students that you're teaching, how are they addressing the disparities in Black, brown, trans, indigenous people, and other minoritized groups as far as maternal health? How is that going about, changing your clinic, or how they're being assisted rather?
Yeah, I don't have a full answer on that, because I don't think that we have done enough, by far have not done enough to address the maternal health disparities that exist in Texas, which are profound. And that goes across the, pregnancy capable people healthcare spectrum. It doesn't just apply within abortion. Abortion, is one important part of it. But we're a highly uninsured state. We don't have enough coverage for people postpartum. We don't have, we just don't take care of pregnancy capable people in a way that we should. I think that as far as the, day-to-day on the ground in the clinic, is that we try to meet people where they are. We try to address what barriers folks have, and coordinate with folks like Amanda and Roseanne to help address where there is need, and meet them where they are, so that everybody can get the care that they need. But I mean, tagging on kind of some of what we've already said is like, hearing these stories, and I guess what I would just say is that we are also not hearing all of the stories, right? Just like the call volume is dropped off to these funds, so is the clinic volume dropped off. And so I trained in New Mexico. I experienced prior significant reproductive health barriers in New Mexico. And in that experience, I got to be the person who provided healthcare to 100% of the patients that I saw. And that felt rewarding. And I recognized that I was only seeing the numerator of all of the people who wanted to have an abortion, not the denominator. And now here I am, still recognizing that I am seeing the numerator. It is bigger than the group that was able to get to New Mexico back in my training, but I'm still only seeing a fraction of the people that are actually able to get into the clinic for all of the reasons we already talked about, like over policing, lack of access to a car, lack of access as a teenager to, have some confidential care. And that, the stories that and they're also heartbreaking. And then the stories that you don't know, and knowing that those are still out there, is also heartbreaking.
Thank you very much, Lauren, for sharing. And it leads us to, another major aspect of this discussion is not fully focused on abortion. As we know, abortion is just one part of reproductive justice. And we have a lot of questions, probably the majority of the questions from attendees could be answered maybe by Carrie and Liza if you wanted to kind of go back and forth. But a lot of people are really curious what the implications of SB 8 are for neighboring states in Texas, and then also what people outside of Texas can do to support those in Texas on a policy level.
So I'll speak to the point about the impact of SB 8 on neighboring states. We have been trying to track information on Texas patients going to other facilities in states that border Texas, as well as states a little bit beyond. And we have documented an incredible surge in people going out of state. And this is, the decrease that we saw in people getting abortions in Texas was bigger than we have ever seen. The increase in people going out of state to get care is also bigger than we have ever seen. And what, to tag on to the point Liza made earlier, this is really hard for the facilities, the staff at facilities in other states to manage. Many of the facilities many of the states that surround Texas are also not very friendly to abortion care and abortion providers. So they're dealing with their own state laws, and they're dealing with seeing an extra 250 patients every month who are coming from Texas who need services. Texas staff are going to work in other facilities to help take care of these patients. But the staff in these other facilities are simply overwhelmed by the huge flow of people that are able to make it out of state. And we know that not everybody is able to make it. And, I think this also compromises the care of people who live in those states. These are small facilities, and seeing an extra 200 patients a month may not provide appointment options for people who live in those states, who then may be pushed elsewhere or denied care altogether. So while this is a state-specific law right now, it really is having ripple effects beyond Texas's borders.
Yeah, I'll just add something that I think drives that point home, which is when we think about how SB affects other states, I can't emphasize enough, there is no standalone one-off abortion restriction that represents the middle ground of how the constituents in that state feels. The motivation behind any abortion restriction is to, one, compromise the integrity of the healthcare system where abortion is provided by making it difficult, expensive, tedious, up to impossible to provide abortions. And Carrie just detailed how SB 8 in particular has laid out. But we've seen that with all types of abortion restrictions. And, if you go back into TexPEP's past, any type of abortion restriction, they've done research that documents that layered effect. And remember, this is not Texas's first rodeo. Texas has a dozen or more major abortion restrictions on the books already. A set of which already went to the Supreme Court. If all that was restricted was abortion at the fetal tone or whatever at 6 weeks, that would still be horrific. But all of the other restrictions for someone who realizes their abortion still have to be adhered to. And secondly, any abortion restriction, particularly these types that are very extreme, is a direct effort to overturn Roe. That is the intention of them. And that is why these restrictions get more severe every time the Supreme Court changes. So how it affects other states is that it signals to the anti-abortion movement in other states what they can start testing out there. So that's sort of like the policy piece of that. And so, if you think about abortion as healthcare, the infrastructure for delivering that is being eroded away. And secondly, it's not just that abortion access will now be a patchwork and you'll have good states and bad states. Should SB 8 sort of be upheld, whether because of what will happen in June when the Mississippi case gets decided or for other reasons, we're going to start seeing an erosion over time. And it will take years, but the momentum will happen.
Wow. Those are made some great points, 100%. And I would be remiss as us being in the School of Social Work and not to mention social workers and ways in which we can help. As we all know, social workers into interdisciplinary field. And at some point in time, I'm pretty sure all you have worked with social workers, and I know there's social workers among us here today. So the question would be, how can social workers, whether it be in the macro, micro, policy level, and this question I'm open to everyone, so feel free to jump in. How can we get involved, and how can we work with any one of those directions on the macro level, and the micro level, policy level? What does it look like for us to work alongside you and to advocate and to help folks?
I feel obligated to start because I'm a social worker, so I will, but I would love to hear from any of my colleagues on their fresh perspective on this as well. But I mean, like y'all know this, right? Like social workers are advocates. Like we are advocates in every sense of that word, whether that's micro or macro or mezzo, or, but I think that's, to interrogate what that means for you is like the crux of, I think, your social work path. And I think what the beauty about social work is also, that we are taught to be systems thinkers, right? And to really think like, gosh, this is every single barrier that for example, for abortion funds that our clients are facing, right? It's a symptom of a larger system. And so to interrogate what are those systems and how can I make an impact, great or small, at that system, at that root cause of what's creating the harm, of what's creating the oppression. Like that, these are the questions that we have to keep confronting in our work. And I think you can do that at any level of social work. I will also just say, especially for clinical folks, first of all, I hired a freaking social worker. Like I was like, oh, yes, we have a licensed clinical social worker on our staff. This was one of the first people I hired was a social worker, because I knew that a social work lens is so important to bringing empathy and humanity to our work. And we work with clients who are suffering and who are facing barriers. Like who better to help, steward them and to be, a companion in this process than a social worker. And also shout out to doulas, but like, I think there's so many places for social workers to fit along the journey of someone accessing abortion. And first and foremost, you have to understand abortion stigma, and you have to understand that abortion is so nuanced and every experience is different. And what we really need as someone who's had an abortion, I can say, at least speaking for me, is someone to listen, and to someone who can be there for you, and to validate the decision that we are faced with when we make an abortion decision. So I think there's so many different ways social workers can show up for this movement. It's about interrogating questions, embodying what being an advocate means for you, and supporting people who have abortions. And you know how to do that. You have the skill set to do that. And so just reach out and see where that takes you.
I'll just say a quick thing. I'm not a social worker. My discipline is public health. But I will say, as someone who was very, very lucky to early in my career to work with academics, including Carrie, who felt abortion was absolutely an appropriate subject for public health and sociological oriented research. I would say that social work school is a place for leaders and students to challenge the idea that abortion is not an appropriate topic to be teaching and researching and thinking about within the school. There's some great researchers out there in social work schools who I don't know personally, but one of them that comes to mind is Gretchen Eli. is a professor who has worked with the National Network of Abortion Funds to use social work frameworks to look at the impact of abortion funding on abortion patients, for example. So find mentors, and if you're teaching, introduce into your syllabi the role that systems of oppression play and how abortion restrictions are leveraged to uphold them. Because my experience as a public health student was being often questioned whether or not an abortion was an appropriate public health topic. And I was so lucky to find mentors who were like, yeah, it absolutely is. But like 15 years ago, that was up in the air. So, you know, this event is just one example of leveraging the learning space for that. So thank you.
And then to kind of go off of, you know, a few things we've talked about earlier, we obviously have a lot of social workers here. But we also have a lot of New Yorkers and East Coasters. And a lot of people are curious what we think the implications of SB8 could have in New York, or what we think of the how we think about SB8 changing reproductive justice nationwide, but more specifically in blue states where people don't fear like the lack of abortion access. Curious if anyone can answer that.
I can start. So low-key, I moved from New York to Texas to do abortion work. So you can always do that. We need you, come move here. I do think one big piece is that, yes, I know there's always this blue state, red state conversation, but like a lot of the support we saw when SB took effect at Jane's due process was people from New York and California and DC, like donating and raising up what was happening on their social media and like actually talking about it. And it made a lot of us, I know on our staff, feel like we weren't shouting into a void or a vacuum. You also have the ability to put pressure on your electeds, especially on the federal level, to do something. So there's multiple pieces of federal legislation that could improve abortion access, including the Women's Health Protection Act, which passed through the House and would protect and formalize the right to abortion on the federal level. It is sitting in the Senate. It has not gotten a vote. You have senators, you can push them. So I think one piece is realizing that we are all connected on the federal fight. And then another is really knowing in detail what access looks like in your state. I know in New York, there's wonderful things like the commitment to actually fund abortion care, both with things like Medicaid, but also the city of New York is giving money to the New York Abortion Act, New York City's abortion fund. I mean, that's really powerful. Municipal funding of abortion care is radical and should be happening in more places. And also making sure there aren't restrictions, you know, in your professions. Something we see in Texas sometimes is professions will restrict people from talking about all forms of reproductive health care. I pushed on that in law school. They wouldn't talk about abortion in school because it was too political. So I think just really thinking through all of your communities. You might think that you're in New York and it's totally blue and you don't have to think about it, but actually there might be a lot of spaces where abortion stigma lives that you can push on.
Yeah, thank you for sharing that, Roseanne. I can open this question to everyone, but I would love for you if you can answer it first, if you don't mind. And that is about the trigger laws. We noticed that after the SB8, that we saw more states starting to crack down. So if you could share your thoughts, you know, on that, and what are just different things you think that need to take place in order to make the change that we want to see?
Sure, I can just define briefly. So a trigger law is a law that on a state level says if the US Supreme Court overturns Roe v. Wade or substantially changes the standard for whether there's a legal right to abortion, a state automatically loses abortion care. Texas passed a trigger law the same time they passed SB8. It was another one of our governor's priorities. So it really shows you that this is strategic, this was intentional. My home state of Ohio has been trying to pass one. There's, you know, dozens of efforts and several states have passed them. And so that's why a lot of people are talking about this summer's Supreme Court case, Dobbs, which if the US Supreme Court severely undercuts Roe v. Wade, could allow these trigger laws to take effect. So that's kind of what a trigger law is and what we saw here in Texas. And I'll let other folks speak to the second half.
I can just pipe in here from my very specific lens, I would say, as an educator and a clinician for educating future OBGYNs, and that, one of the really devastating things about SB8 is that we are losing the ability to train our own residents in family planning entirely. And not just family planning, when I say family planning, what I mean to say is that doesn't just apply to abortion education, which is a really important part of it, but residents who train in family planning are also much more capable and competent in taking care of ectopic pregnancy, molar pregnancy, and in general, early first trimester complications of pregnancy, miscarriage. And so when you think about half the country losing access to abortion, that is devastating. And the idea that half of the country's training OBGYNs will also lose the ability to train in these things creates this generational ripple effect that, you may not think that this law will affect you because maybe you can't get pregnant, or you're not planning to get pregnant, or et cetera, et cetera. But I think that there is a lot of stuff of just general healthcare that is also caught in the crossfires of it. And back to in the red state, blue state conversation, I would say that part of what we anticipate to happen in states without trigger laws is that there's going to be a huge influx of patients, like Carrie was saying, is already happening around SB8. And from a clinical perspective, that is terrifying, because you have to think completely differently about how you run your clinical operations to accommodate, a 2, 3, 5, 50-fold increase in seeing patients, and still see people in a way that's safe and compassionate. And that's hard to do.
Thank you, Lauren, for responding to that. While we have you, I think you could answer this question really well. We have obviously a lot of social workers, a lot of clinicians here. And one thing a lot of people are worried about is the increased occurrence of self-sourced abortions. And I'm curious if you or anyone else could speak about, what you think that could look like in a year or two if these policies keep piling up.
Yeah, I think one thing I'll say to start out with is that self-sourced abortion has been happening before SB8. And also that we have a lot of evidence now that says that patients don't necessarily need to be seen in the clinic. And there are a lot of ways to make abortion more accessible to folks, including providing teleservices and mailing medications. I think one of the things that I worry about is when folks there's a difference between when folks choose to self-source their abortion and when someone is forced to self-source their abortion. And I think that people that are forced to self-source their abortion and do not feel comfortable with it, it runs the risk of further stigmatizing that choice, especially as we've talked about earlier, in the situation that we're in Texas, where people are fearful of being policed around this decision, that they can't seek care and are afraid to seek care. And I think that's something that I worry about.
I'll add a couple of things here too. Absolutely. Just like Dr. Thaxton said, self-sourced abortions have been happening in the United States for many years. And particularly, we think in Texas, a place that has a border with Mexico, where a safe method of self-managed abortion, misoprostol, can be bought in pharmacies. Carrie and I actually have a paper together where we did qualitative, in-depth interviews with women in Texas who attempted to self-manage an abortion. Everyone that was able to obtain misoprostol was able to complete a safe abortion. In the context where we are now, where the FDA has said abortion medications can be picked up at a pharmacy or mailed to you, the line between a self-managed abortion that's outside of the healthcare system and inside the healthcare system is really, where did you get the pills from, right? So there's a few concerns. One, do people know the right regimen given the medications that they have? That is something that we can work on making available to people, and many groups have done that already. When we think about safety, even misoprostol alone, there is a very safe regimen for completing abortion. But I want to put the emphasis on something that you said, Lauren, which is the part of safety that we're concerned with is being subject to the criminal justice system. And there's a couple of reasons. The laws around whether or not someone can do an abortion on their own outside the care of a clinician is gray area in a lot of places. And some states have actually arrested and tried to prosecute women for doing this in the past. One of the things that SB 8 has signaled to us is that criminalizing abortion, not just having a restriction on it, is fair game. And the pathway between SB 8 and criminalizing the person seeking abortion is something that we really need to consider. And we know this is realistic because many states already have either attempted or put laws in place that criminalize pregnant women for their behavior during pregnancy, whether they've used drugs, whether they have a suspect miscarriage. And so this also gets into, what does it even mean to have a miscarriage in a restrictive abortion state, right? Anybody who has first trimester bleeding during a pregnancy is now suspect, right? Any clinician who wants to manage a miscarriage using aspiration probably has to go through ridiculous hoops to document fetal demise, or else they may be accused of providing an abortion. And in that case, a self-sourced abortion looks pretty attractive. So I think that where our researchers and clinicians who have been looking at this for a long time are really converging on is ensuring that people have access to the right information about the regimen that they can use to safely manage an abortion. Ideally, if they can get it through a healthcare system where it's covered by insurance, that would be great. But in a restrictive environment, what we're going to be concerned about is the way that the criminal justice system is going to start managing this. We don't know if people's mail is going to be intercepted. Telemedicine for abortion is banned in Texas. Does that mean that a person in Texas can't get care from a Planned Parenthood in Illinois? These are really difficult and weedy legal questions that as a public health researcher, I don't have the answer to. But the thing I think that is very important that our research shows is that the only problems with self-managed abortion, where we have an abundance of research about the safety of misoprostol and mifepristone, is one, people thinking that they're doing something illegal, because it is an unacceptable violation of their dignity and human rights to believe that they may be doing something dangerous. And they're choosing between their lives, health, and safety and being able to pay their rent or take care of their families. And that's something we found in our Texas research, that people weren't really sure, what the situation was, but what they do know is that they couldn't be pregnant. And so in terms of reproductive justice, having being able to decide if, when, and how you want to be pregnant with dignity and psychological safety is also important. And then secondly, people's legal safety. Look, one thing to know pre-Roe is that women were not sent to jail. Pregnant people were not sent to jail for procuring abortion. Some illegal abortion providers were. It was highly stigmatized. But we're in a new world order where self-sourced abortion is safe, whereas then it wasn't. But legally, the public or legislative or anti-abortion attitude around criminalizing women is sort of open. So.
Yeah, that was a lot of useful information, and I like how you put it with the historical piece to it as well, from where we were before to where we are today. Thank you for that, Liza. A lot of folks have been asking how can they keep in contact with you all and how can they follow some of the work that you're doing. So if you feel comfortable with either sharing an email or if you have any socials for you or your organization so that the folks here that are in attendance can stay connected with you all and see some of the great work that you're doing. Because it was just mentioned that there was a study that was done, a qualitative study. I know that's a lot, that's up the alley for a lot of folks. So we would love to, if you can just share that information with us.
Thank you so much. And just as we're wrapping up, we have another question that we would love for everybody to answer if they have a moment. We'll give everybody like 30 seconds. A really great question that came in was, who or what do you look towards to stay hopeful and inspired when there are a lot of feelings of undoing and helplessness? I think this could relate to COVID a lot, but I think very much also the reproductive justice fight, as we see a lot of forward steps and then there's always like baby steps backwards. So I think it'd be great if everybody could answer this.
I can start. I don't know who here has watched Frozen 2, but I can say that I am a 36-year-old woman with no children who has watched Disney Plus, including Frozen 2. And there's a really beautiful song in there called The Next Right Thing. And I just think it's such a beautiful story of grief. And basically what she's saying is that like, this is so heavy that I cannot look at the long horizon. I have to I'm getting all choked up just talking about that. You have to think about what's just in front of you, what's just right in front of you, and do the next right thing, and then do the right thing after that. And that eventually you will find your way into doing a lot of right things. And I think that that is how I feel right now in this moment, is that, you know, I don't have control over SB8. I cannot make it go away, but I can do the next right thing with every single patient that I see every single day. And that's what I have control over.
For me, it is abortion funds. My entry into the work of reproductive justice, I was a reproductive justice organizer, and started an abortion fund, and then kind of went back to school to be a researcher. And abortion funds collectively, and the National Network of Abortion Funds, have never had a stronger voice in the work than they do now, but that voice has always been very radical in the sense of holding a vision of abortion unapologetically being a normal part of our lives that we deserve to be able to access in a timely and safe way, and be held in our communities as we do so. I think when I get into like all of the data and I'm like, I don't know how this confidence interval is correct, and feeling like I can't get the data that I want, that I just circle back to that I'm lucky enough to be able to employ those methods in particular service of a reproductive justice vision. And if I'm kind of getting away from that, or despairing, that I just go back to, you know, the vision that the funds put forth, which is centering the whole dignity of people who need abortions. And the rest of it, I can kind of figure out what my part is. So I'm grateful for you all for continuing to be unapologetic and having a clear voice.
Yeah, I feel like something that gives me hope is that I know that abortion funds were built for this moment, like we really were, and that we're like standing on the shoulders of so many, you know, communities who have been building up a movement that is just so incredibly strong and creative and fierce. And in Texas, I'm like pretty much triggered by the word resilient, but it's like, we embody resilience, and it is like, for those of us like living in the South, like it's like cellular, like, you know, it's just like what we know. It's all I know, you know, I mean, born and raised Texan, like this is just my world, my life. And I just would never want to be anywhere else. Like I feel so called to be here doing this work. And I feel so proud to be doing it with the people that I get to do it with every single day, because together we were built for this.
It's low-key impossible to follow Amanda, but I'll try. Um, I just plus one to what everyone has shared. I think for me, getting to work with young people, teenagers who are facing this scenario in Texas right now, still manage to like make it work under impossible circumstances, and then also to get pissed as hell and like want to be advocates, and I love that. And it gives me a lot of hope that this is like the last gasp of systemic oppression in so many ways. It's the intersection of so many types of racism and sexism and misogyny and hate, but that we are building towards something better. And I see that a lot in the youth that we serve. And then also just getting to be on panels like this. I said this when we were prepping, but like getting to be on panels with people I get to work with who are amazing. It's a really beautiful community in Texas. So we're very lucky.
For me, I guess, you know, knowing that there's so much history that's gone before us, and that, you know, people have, you know, with civil rights and women's rights have struggled in these battles before, and just knowing that history and refusing to accept that this is going to be the future that we live in, and knowing that we need to fight to make it different. I mean, I think just my innate stubbornness and resilience as well, like Amanda said, is what I think brings me back to doing this work, and knowing it may not be next year, but I can't live where this is our reality. Like, we have to fight for something better than that.
Yeah, those are great. And then you started off with Frozen too. I mean, I love both of the Frozens. I have a daughter, but you know, you know, when you got me when she said Frozen. So, but I have another question. We have another question for everyone here on the panel, and we'll go ahead and I guess we'll start with Amanda, and then everyone else can kind of just answer like how we done before. And that is, a lot of information was shared tonight. It was really rich, and the conversation was really dense. But what we want to do is kind of just give folks some marching orders per se, and then also perhaps what is one takeaway that you want someone that has heard all of you speak, for one takeaway for them to have, and then also one actionable step that we can take to really get the work done.
Oh, it's so hard to like pick one, but oh gosh, Lauren, the next right thing is just like, that's so beautiful. I'm like, I'm gonna use that and attribute it to you from now on. But I feel like I have to just say, like, support the infrastructure, right? Like, we know this is a long fight. We can't rely on the courts. We can't rely on our governments, but what we can do is support the infrastructure of folks that have been doing this work for so long. So of course, abortion funds, also independent abortion providers who are doing the majority of the abortions across the country, like, they need us, right? If we're going to have to send folks, trigger states are gonna have to send folks to where there's non-trigger states, think about who's gonna be seeing those patients and who needs that support. It's independent abortion providers. So I think just like, think as grassroots as possible and support the infrastructure. There's so many resources. This work is not new. Just tap into it. See where you can donate, volunteer, and show up in any way you can.
I think I would just add, yes, donate, absolutely donate. And don't stop talking about it. I know we're supposed to end on a positive note, but I just have to say, one of the things that has been particularly frustrating about this moment is people who are often surprised at how we got here. And none of us are surprised at how we got here. But more people need to talk about it. So talk about it. Share your story if you feel comfortable, but just talk about what this means for human rights and how this is undermining human rights. Because if we stop talking about it, then we allow this to happen.
I'll tag on what Carrie said, because that's exactly kind of the line of thinking that I was having. And, you know, there was a question in the chat about what can I do? And my state is proposing similar laws. And I think, you know, everybody's unique politics are going to be different. Texas is a whole wild landscape of politics. But I do think that, like Carrie said, you know, reproductive rights affects everyone. And often, you know, to give a little, the depressing side of things is that oftentimes we feel like, as abortion providers, as networks, as advocates, we are the people that everybody says, like, oh, well, it's okay, like they'll take care of this latest assault. But really what we need is everybody. I think that's clear. We are at a moment in time where we need every single person to stand up and say, like, this is important because this is healthcare, this is humanity and access to a human right. So I don't have to be an OBGYN. I don't have to be an abortion network fund. I don't have to work in an abortion clinic to say that it's important that we have access to abortion.
Agree with what everyone said, and I'll kind of put it this way. Whatever you're doing, what's the next thing you can do? If you're already donating to abortion funds, can you have a party for an abortion fund, right? Think about the next level thing that you can do. If you feel comfortable talking about your abortion or talking about abortion in a place where it's not the usual suspects, can you take it to the next level? And also think about the ways that people can plug in that's meaningful to them. Truly and unfortunately, donating to an abortion fund or volunteering for an abortion fund isn't actually what speaks to every single person about this issue. But I mean, I think I heard Olivia maybe say that there are a lot of clinicians and social workers on here. Truly, I believe this. Bringing professionals to the place where they can leverage the prestige of their voice and the power of their voice as professionals we still have a long way to go. I so appreciate the social workers and Dr. Thaxton for being here. There's organizations like for Physicians for Reproductive Health that train doctors to be able to speak with confidence about these things. And, you know, for worse or for worse, the medical profession has been very conservative about this issue, and we're just now seeing AMA and ACOG really weigh in on the laws and things like that well within the past 10 years. There's medical students for choice that pay for medical students in places where they can't be on rotation to learn how to do abortions to go do that. If you now have someone in your life for whom supporting medical students would speak to them, help them donate to get more people trained. The chinks in the chain of making sure people have access to abortion are many. My personal passion and what I think is important is, as Amanda said, the infrastructure to get people from a pregnancy test to the outcome that they want. But we need people to do abortions, and writing a prescription for medication is going to be a great solution in the future if things go south. But I won't accept a landscape where someone who prefers an aspiration abortion, prefers to be seen by a clinician, is told, well, it's too bad because we don't really value that here, so we're going to give you this other option. Quality healthcare is people being able to choose among the gold standard options for that treatment, the one that's best for them. So my dream is everyone to be able to get an affordable or free abortion of their choosing when they want. And that means that the role of clinicians, social workers, and people who are bringing people into the healthcare system or trying to get them out is not going to be diminished just because we can pick up Med-AB at the pharmacy.
I love that, Liza. Like, that's the vision. So mine's it's a little bit of a practice, and it was actually given to me by my first boss when I got my first job in Repro, Lisa Maldonado. She's amazing. I know, Liza, I know you know her. But it was to say abortion every single day for a week. And then once you said it every day for a week, say it for a month. And then once you say it for a month, say it for a year. I think it helps push you to both be forward on your beliefs and also to find your own edge. Because, you know, the day you don't want to say it, you got to be like, well, why am I not saying it? Like, what's going on in this situation? Is it because I'm at dinner with my mom? So like, I think it was a really good thing that helped me get to a good place. So I hope it's helpful to other folks too.
Well, we're pretty much right on time, but I think for the sake of everyone who's been here for an hour and a half or more, we'll probably end here. Just wanted to thank everybody so much for coming to this. We really loved hearing from you all, and it was really great to be introduced to you and your work and for everything that you shared in the chat.